Welcome to America's Heroes Group. Roundtable radio, print, digital media has transcended race, creed, and color via disseminating information, resources, and referrals intentionally to empower our military population. And we are the change agents of the military experience. Today we are proudly sponsored by America's Heroes Group. Sponsors Pearl's Place, Down Home, Southern Cooking, 3901 South Michigan, Chicago, Illinois. Phone number 877-275-5852. Also, America's Heroes Group is proudly sponsored by veteran business owner Here's Gulf Shrimp, 7448 South Vincennes Avenue, Chicago, Illinois, 60621. A veteran-owned business. Call 773-783-1818. Also, we are proudly sponsored by our longtime friend and attorney, Steve Seidman of Seidman, Margulis and Fearman, LLP, 20 South Clark Street, 2 First National Plaza, Suite 700, Chicago, Illinois, 60603, toll-free number 888-837-3275, office number 312-781-1977. If you have a military problem in the legal arena, make sure you call this man. He is great. Also, America's Heroes Group Roundtable with partner VHPI, Veterans Healthcare Policy Institute. Today is Saturday, October 17th, 2020. October is Breast Cancer and National Domestic Violence Awareness Month. We have our host always is Cliff Kelly. I'm a co-host, Colonel Dr. Damon Arnold, executive producer Glenda Smith, digital media producer Manny Carazari, assistant digital media producer Al Greer. Saturday's topics for today, we're actually going to be speaking to some panelists. Brett Copeland is a VHPI executive director of a nonprofit Veteran Healthcare Policy Institute, an organization founded by veterans, healthcare providers, and journalists. Brett worked on Capitol Hill as a communications director for a labor union that represented VA employees. Also, we're joined by Lindsay Church, executive director and co-founder of Minority Veterans of America. Minority Veterans of America's mission is to create belonging and advance equity for minority veterans. This includes people of color, women, LGBT community, religious and non-religious minorities, and allies. MVA advocates for equality, respect, and justice for all minority veterans. Well, it is a pleasure to have both of you here. Why don't you give us a lead-in, Lindsay?
Hi. Thank you for having me. My name is Lindsay Church. I'm a Navy veteran. I served in the Navy from 2008 to 2012. Returned home after duty and went to college for a bit, and then ended up starting and co-founding the Minority Veterans of America.
Oh, fantastic. And we have Brett on the line. He is the VHPI Executive Director. And we are so proud of the work you've been doing, Brett. Thank you, Lindsay, for your service, and also Brett for yours.
Thank you, and very happy to be back. And unfortunately, we don't have a ton that's positive to report. Since October 1st, there's been a 24% increase in active COVID cases, especially across the Midwest. We're seeing spikes in Milwaukee, Wisconsin, Nebraska, Western Iowa, Missouri, and actually North Chicago seeing a spikes at their VA healthcare system there as well. Secretary Wilkie predicted that there would be a boomerang after kind of the spring and summer months, that we would be seeing this increase in cases, but we still don't have the testing that we need. Hospitalizations are still increasing, and we just, it hasn't been addressed like it needs to. And unfortunately, the burden of this disease is falling on non-white Americans who are dying at hugely disproportionate rates compared to white Americans. Black, Latino, and Hispanic Americans are actually more likely to contract COVID-19, require hospitalization, and die from it. American Indians are also incredibly overrepresented in those fatalities.
Oh,
it's actually 1 in every 1,020 Black Americans have died or have been killed from COVID-19. It's an incredible number.
Oh, it is absolutely tragic. I sort of work in the insurance industry in my spare time, but actually, one of the things is that the Centers for Medicaid and Medicare Services put out a report, and they said that if you are African American, you're almost 4 times more likely to be hospitalized. If you are of Hispanic or Latino descent, you are about 2.5 times. If you're Asian descent, 1.5 times that of the general white population. And if you are with end-stage renal disease and you are with Medicare, Medicaid, dual eligibility, you actually are 11 times more likely to be hospitalized than the general population. And so we do have more chronic disease in these populations, but some of the problem is that it's never really been adequately treated because of access issues and social determinants of health and such, some things like that. But, how is this really affecting our veteran population? Because we know we have veterans who are being taken care of in the VA system. We have people who are veterans who are actually being taken in the traditional healthcare system. And then we have homeless veterans. So what is the sort of the layout of that? How is that affecting us as a group?
Well, exactly what you just said. Populations of color are really getting the brunt of this, and that's absolutely true for the veteran population as well. They're more susceptible just because of their military service, the wear and tear on their bodies from service, mental health conditions. There's a study that came out last week that said that people with a psychiatric diagnosis are almost 50% more likely to die after COVID-19 hospitalization.
Wow. Plus
toxic exposures. Veterans are a very high-risk group, and one of the only kind of equitable healthcare systems. That's happening in the private sector where a lot of these deaths are happening. But kind of the most equitable and largest healthcare system that we have in the U.S. that veterans fortunately have access to is the VA. And I think that, a lot of folks are waiting for relief, and luckily our veterans do have access to the VA. But if you look at the White House or Congress and even leadership at legacy veteran service organizations, they have failed to elevate issues of veterans of color, especially healthcare issues. And I think that's one of the reasons why Lindsay's work at Minority Veterans of America is such a critical organization.
Yeah, Lindsay, why don't you tell us a little bit more about that? Because I know Minority Veterans of America, you founded that in 2017, and your co-founder was Catherine Pratt. But you began your work back in 2014 through the Husky United Military Veterans. So tell us a little bit more. Why did you start this group? Why is it so important, and what do you do?
Absolutely. We started MBA back in 2017. I was the post commander of an American Legion, and both of us went to school at the University of Washington. We were both student veterans. We had met through some different work that we've been doing around the diversity committee, trying to increase minority veterans engaging and being a part of student veteran activities. We saw it early as in a smaller population. Myself, I ended up being the post commander at American Legion. My first night, I was told that it was okay that I was gay, but I didn't need to talk about my wife. And this kind of continued down this route. I would host meetings, and people would drop racial slurs. I would host post command meetings, and women would be hit on as soon as they walked in the door. And so what I was seeing over and over again was here I was leading this post and leading this organization, and I was complicit in my own oppression when I was doing so. I recognized at some point that me continue to perpetuate this organization that continues to deny what I need and continues to perpetuate harm to minority communities, I was doing the wrong thing. And so myself and Catherine Pratt, Catherine is a Korean American woman veteran, I'm a white gender nonconforming woman veteran, and the two of us, we recognized that I was never going to understand what it felt like to live in skin that wasn't white, and she was never going to understand what it felt like to live in a body that wasn't cisgender. But that what we could understand between the two of us was our mutual oppression and marginalization. We could understand that in the veteran community, that if we didn't find a way to come together, where there were the 4 minority groups that we serve are veterans of color, which is 5.5 million, women veterans is 2 million, LGBTQ vets is 1 million, religious and non-religious minorities are about 1.6 million. But when you take all these together, they're small numbers by themselves, right? Like LGBTQ vets, we are about 5% of the population, but to be able to advocate for our needs, we need a greater voice than that. And the same thing for each one of our groups that we serve, that if we don't find a way to coalition build and build an intersectional movement that brings about different voices and brings different people into the fold, including allies who are here to fight with us, we're not actually going to create change. And so for us, we've always taken like a movement building rather than an organization building lens to what we do, because what we're doing is trying to create change, and change doesn't come from an organization, it comes from a movement. And so we started this back in 2017. I find it very fortunate that we did what we did when we did it, because now here we are in 2020, and rather than not having the tools to be able to equip and serve our community right now, we spent the last 3 years building our organization so that right now is the moment that we can do the work that we do best. In the face of COVID, you all were talking about the systemic inequities towards and disparities towards people of color specifically, and we have seen this even in our own work. So since COVID happened started back in March, we have started a COVID relief fund that we have about $100,000 to give away. We have $27,000 that we've given away already. We've seen almost 1,000 applications, and half of them have been Black. Half of them have been unemployed as well. We've seen a rise in this need. We're not healthcare ourselves, so we see the after effects, the unemployment as a result of COVID, the fact that Black and African American, Latinx, and Indigenous folks have to go back as essential workers, the fact that most folks don't have an opportunity to sit back and work behind a computer screen is the reason why we're seeing these numbers the way that we are. In addition, the communities that we serve are already under-resourced before the pandemic. So now that the pandemic has hit, we're actually seeing worse outcomes, especially when it comes to healthcare. So VA has pivoted to telehealth being their main delivery for especially mental health, if not all of their services. While communities that don't have computers or access to technology or cell phones cannot access a doctor that is now only doing virtual appointments. In addition, when you look at under-resourced communities, the internet access is actually way worse than in predominantly white communities that are affluent. And when you look at tribal and indigenous lands, you're also seeing that there is almost no access, worse than rural veterans, to be able to get access to care on a regular day. But when you add the pandemic as an extra lens, it only gets worse. So that's a little bit about what we do and a little bit about what we've seen. Sorry, I just rambled for a bit.
Okay, excellent. Very, very good information. We always have time for like one or two callers with a very short question. If you want to call in, it's 773-591-1690. 773-591-1690. But, when you were talking, I was thinking, I was a colonel in the military before I retired. And part of the code that in an oath we take, both as enlisted and as officers, is that you are supposed to uphold the Constitution. You're supposed to be fighting for those things, and we're supposed to be living lives of an example of what that is supposed to be. What we would like to envision for America. We don't set the moral compass for the country. We secure the rallying places for debate and discussion, and then the American people vote and decide what they want this country to do. But it seems as though, as veterans, we should be living the life of what you're talking about, right? We should be recognizing these inequities and making sure that we're standing up for what's right.
Absolutely. I know myself that when I was in the uniform, I served almost all of my time under Don't Ask, Don't Tell. I think I had about 3 months that I wasn't under Don't Ask, Don't Tell. It was right at the tail end. I didn't have an opportunity to fight against Don't Ask, Don't Tell because my primary job and my primary mission was to uphold and defend the Constitution, just to your point, that the Constitution and my military's obligation was what I was most responsible for in that moment. When somebody else fought for my rights as a career service member to serve and remove Don't Ask, Don't Tell. Here I am in 2017 when we started this organization and the trans ban was announced. It was my turn and my opportunity to fight for what was right for the Department of Defense to ensure that those folks can serve, even though we still haven't won that fight. But much to your point, as veterans, it is our job to speak up against injustice and to fight for a country that we believe in and to continue to fight in the ways that we couldn't when we were in active duty.
Yeah, I can't believe how fast time moves. We're coming down to the last few minutes. I wish you would stay here all day long. But one of the things that I wanted you to sort of address, what are some of the obstacles you've seen, and what are some of the positive stories you can tell us about what your organization does, and how would we contact the organization? Is there a telephone number or website?
Absolutely. Yes, you can contact the organization. You can find us at minorityvets.org. There's a contact form on there. You can join the organization. You don't have to be a military veteran. We do bring in allies that are here to fight the fight with us. Some of the greatest things that we've seen, or at least in the past few years that we've come against, is really a cultural shift is happening, and the pushback against that is probably one of the hardest things that we as an organization, as a community, and we see this now, other country kind of faces the same thing, is that like we have to push the needle, and it's hard and it's going to get harder, and people continue to push back against the needs that we clearly see from minority vets. And so for us, like we just keep pushing against that wall to say like there are unique needs here. We are not trying to separate the community. What we are trying to do is advocate for these unique needs, and that's the most important thing that we can do right now. So we do anticipate that there will continue to be pushback because minority needs aren't always the first thing that people want to think about. But we always continue to say when you program and you serve the margins first, you're actually able to serve the bulk of people better. So that's going to be what I live and die by. But some success stories. I don't know who watches football, but if you're a Seahawks fan, we actually just had an opportunity last Saturday. We were out in Seattle. We did what's called the supply drop, and we partnered with the Seahawks and an organization that serves veterans called Fob Pope. We were able to serve 30 families with supply drop kits. We were able to give them gas cards, food cards, backpacks with hygiene kits, supplies, PPE, those types of things, all gearing up for a fall feast/Thanksgiving event. We were also just selected by the Seahawks as their Salute to Service Charity of the Year.
Oh, congratulations. That is fantastic.
Thank you. I know you're in like Chicago, so the Bears are probably bigger there, but like most people at least know the Seahawks, so there's that.
Well, we pray for the Bears here all the time.
The rest of the country is feeling that too, don't worry.
Okay, yes. Okay, so,
I hope everyone will join us. We're actually going to have an extended conversation about disparities in care for veterans on Tuesday, October 20th at 1 p.m. Eastern, 12 Central. You can find more information on that at veteranspolicy.org.
Okay,
but Lindsay is going to help us lead that conversation on how we can make sure that minority veterans are getting the care that they need, especially amid COVID-19.
Okay, great. Veteranspolicy.org. I'll be on that station tonight looking at that. So, what I'm going to do, so that's Tuesday, October 20th. That sounds like a great time. Why don't you close us out? Give us what people need to know as a quick hit, the email address or your any kind of web address that you'd like them to go to, or any phone numbers that are important. But what is it in a nutshell? What do you want people to know about MVA?
Well, go to Veterans Policy. I'm sorry, Lindsay, go ahead.
No, go ahead. You're up.
I was just going to say, please go to veteranspolicy.org. You'll find more information about MVA through our discussion on Tuesday. But really, we need folks to be looking at the White House, at President Trump, at Congress, because 13.4 million Americans are going to be losing their unemployment benefits at the end of this year. Yes. Tens of millions could be losing their job-based health care insurance. And that's going to have a huge effect, not just on, everyone, but specifically veterans. Again, get to know your veteran status now. Get to know where your VA is, because you don't want to be put in a position where you need health care.
Okay,
and you
Brett.
don't know how to get it.
Okay, thank you very much, but we're out of time. Thank you, Brett. You are wonderful. VHPI Executive Director, and Lindsay Church, continue doing your great work with MVA. And we will have you back at some point in time in the future, so we need to continue this conversation. Thank you.